हेलो फ्रेंड। थर्ड नंबर का हमारा चैप्टर है रिप्रोडक्टिव हेल्थ। 3.1 रिप्रोडक्टिव हेल्थ प्रॉब्लम्स एंड स्ट्रेटजीज। 3.2 पॉपुलेशन एक्सप्लोजन एंड बर्थ कंट्रोल। 3.3 मेडिकल टर्मिनेशन ऑफ प्रेगनेंसी। 3.4 सेक्सुअली ट्रांसमिटेड डिसीजेस। 3.5 infertility. You have learnt about human reproductive system and its functions in chapter 2. Now let's discuss a closely related topic, reproductive health. What do we understand by this term? The term simply refers to healthy reproductive perspective and includes the emotional and social aspects of reproduction also. According to the World Health Organization (WHO), reproductive health means a total emotional, behavioral and social. Therefore, a society is a society with people having physically and functionally normal reproductive organs and normal emotional and behavioral interactions among them in all sex related aspects with might be called reproductively healthy. Why it is significant to maintain reproductive health and what are the methods taken up to achieve it? Let us examine them. Reproductive health problems and strategies. India was amongst the first countries in the world to initiate action plans and programs at a national level to attain total reproductive health as a social goal. These programs called family planning were initiated in 1951 and were periodically assessed over the past decades. Improved programs covering wider reproduction related areas are currently in operation under the popular name reproductive and child health or care RCH programs, creating awareness among people about various reproduction relative aspects and providing facilities and support for building up a reproductively healthy society are the major tasks under these programs. With the help of audio visual and the print media, government and non-government agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, other close relatives, teachers and friends also have a major role in the dissemination of the above information. Introduction of sex education in schools should also be encouraged to provide half right information to the young so as to discourage children from believing in myths and having misconceptions about sex related aspects. Proper information about reproductive organs and adolescence and related changes, safe and hygiene sexual practices, the sexual transmitted diseases, STD, AIDS, etc. Would help people, especially those in the adolescent age group, to couples and for who's in a marriageable age group about available birth control options, care of pregnant mothers, postnatal care of the mother, child importance of breastfeeding, equal opportunities for the male and female child, etc. Would address the importance of bringing up socially conscious uh, healthy families of desired size, awareness of people due to uncontrolled population growth, social evils like sex abuse and sex related crimes, etc. need to be created to enable people to think and take up necessary steps to prevent them and thereby build up a socially responsible and healthy society. Successful implementation of various action plans to attain reproductive health requires strong infrastructural facilities, professional experience, and material support. These are essential to provide medical assistance and care to people in reproduction related problems like pregnancy, delivery, STDs, abortions, contraception, menstrual problems, fertility, etc. Implementation of better techniques and new strategies from time to time are also required to provide a more efficient care and assistance of to people. Statutory ban on amino for massive child immunization immunization, etc., are some programs that merit mention in this connection in amino synthesis. Some of the amniotic fluid of the developing fetus is taken to analyze the fetal cells and dissolved substances. This procedure is used to test for the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. Determine the survivability of the fetus. Research on various reproductive related are the areas are encouraged and supported by government and non-governmental agencies to find out new methods and to provide upon the existing ones. Do you know that Sahel on the new oral contraceptive Saheli, a new oral contraceptives for the females was developed by scientists at Central Drugs Research Institute (CDRI) in Lucknow, India. Better awareness about sex related matters, increase the number of medically assisted deliveries, and better postnatal care leading to decreased maternal and infant mortality rates, increased number of couples with the small families, better detection and cure of STDs, and overall increased medical facilities for all sex related problems, etc. All indicate improved reproductive health of the society, population stabilization, and birth control in the last century on all around development in various fields significantly improved the quality of life of the people. However, increased health facilities along with better living conditions had an explosive impact on the growth of population. The world population, which was around 2 billion to 200 million in 19 rocketed to about 6 billion by 2000 and 7.2 billion in 2011. Now, a similar trend was observed in India too. Our population, which was approximately 350 million at the time of our independence, reached close to the billion mark by 2000 and crossed 1.2 billion in May 2011. A rapid decline in death rate, maternal mortality rate (MMR) and infant mortality rate (IMR), as well as an increase in number of people in reproductive usable and are probable reasons for this. Through our reproductive child health (RCH) program, so through the could bring down the population growth rate. It was only marginal. According to 2011 census report, the population growth rate was less than 2%. That is 21,000 per year. A rate at which our population could increase rapidly, such an alarming growth rate could lead to the absolute scarcity of even the basic requirements, that is food, shelter, and clothing. In spite of significant progress made in these areas, therefore, the government was forced to take up serious measures to check this population growth rate. And the most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. You might have seen couple with two children with the slogan "Hum Hum Do हम दो हमारे दो we two our two many couples, mostly the young urban working ones, have even adopted and one child norm and statutory raising of marriageable age of the female to 18 years and that of the males 21 years and incentives given to couples with small families are two of the other major measures taken now to tackle this problem. Let us describe some of the commonly used contraceptive methods which help prevent unwanted pregnancies. An ideal contraceptive should be user friendly, easily available, effective and reversible with no or least side effects. Could be in should in no way interfere with the sexual drive, desire, or on the sexual act of the user. A wide range of contraceptive methods are presently available, which could be broadly grouped into the following categories, named natural, traditional, barrier, IUDs, oral contraceptives, injectables, implants, and surgical methods. Natural methods work on the principle of avoiding chances of ovum and sperms meeting. Periodic subsistence is one of such method in which the couples avoid and abstain from coitus from day 10 to 17 of the menstrual cycle when ovulation could be expected, as chances of fertilization as are very high during this period. It is called the fertile period. Therefore, by abstaining from coitus during this period, conception could be prevented. Withdrawal or coitus interrupts in another method in which the male partner withdraws his penis from the vagina just before ejaculation so as to avoid insemination. Lactational amenorrhea, absence of menstruation method is based on the fact that ovulation and therefore the cycle do not occur during the as the mother breastfeeds the child fully. Chances of conception are almost nil. However, the method has been reported to be effective only up to a maximum period of 6 months following parturition, as no medicines or devices are used in this method. Side effects are almost nil. The chances of failure through of this method are also high. In barrier methods, ovum and sperms are prevented from physically meeting with the help of barriers. Such methods are available for both males and females. Condoms, figure 3.1 AB, are barriers made of thin rubber latex sheath that are used to cover the penis or in the male or vagina and cervix in the female just before coitus so that the ejaculation semen would not enter into the female reproductive tract. This can prevent conception. Nirod is a popular brand of condom for the male use of condoms has increased in the recent years due to its additional benefits to protecting the user from contracting STIs and AIDS. Both the male and female contraction condoms are disposable, can be self-inserted, and thereby gives privacy to the user. This diaphragms, cervical caps, and walls are also barriers made of rubber that are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of sperms through the cervix. They are reusable spermicides for spermicidal creams Jellies and foams are usually used along with these barriers to increase their contraceptive efficiency. Devices IUDs. These devices are inserted by doctors, by expert nurses in the uterus through vagina. These uterine devices are presently available as the non-medicated IUDs. Example: lips loop, copperly releasing IUD, CUT, CU7, um, multi-load 375, and the hormone releasing IUDs, progestastor LNG20, figure 3.2. IUDs increase phagocytosis of sperms within the uterus, and the copper ion released suppress sperm motility and the fertility capacity of sperms. The hormone releasing IUDs, in addition, make the uterus unsuitable for implantation, and the cervix hostile to the sperms. IUDs are ideal contraceptives for the females who want to delay pregnancy and space children. It is one of most widely accepted methods of contraception in India. Oral administration of small doses of either progestrogens or estrogen combinations is another contraceptive method used by the females. They are used in the form of tablets and hence are popularly called the pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle, and after a gap of 7 days during which menstrual cycle occurs. It has to be repeated in the same pattern until the female desires to prevent conception. They inhibit ovulation and implantation as well as prevent conception. They inhibit ovulation and implantation as well as prevent conception, as well as prevent as well as have to alter the quality of cervical mucus to prevent retarded entry of sperms. Pills are very effective with lesser side effects and are well accepted by the females. Saheli, the new oral contraceptive for the females, contains a non-steroidal preparation. It is once a week pill with very few side effects and high contraceptive value. Progestogens alone or in combination with estrogen can also be used by females as injections or implants under the skin. Figure 3.3. Their mode of action is similar to that of pills, and their effective periods are much longer. Administration of progestogens and progestogen estrogen combinations of or IUDs within 72 hours of coitus have been found to be very effective as emergency contraceptives, as they could be used to avoid possible pregnancy due to rape or casual unprotected intercourse. Surgical methods are also called sterilization are generally advised for the female partner as a terminal method to prevent any more pregnancies. Surgical intervention blocks gametes transport and thereby prevent conception. Sterilization process, the procedure in the female is called the vasectomy, and that in the female tubectomy. The vasectomy or a small part of vas difference this is removed or tied up now through the small incision on the scrotum. Figure 3.4a. Whereas in tubectomy, a small part of fallopian tube is removed And figure 3.4b are tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. It needs to be emphasized that the selection of a suitable contraceptive method and its use should always be undertaken in consultation with qualified medical professionals. One must also remember that contraceptives are not regular requirements for the maintenance of reproductive health. In fact, they are practiced against a natural reproductive event, that is conception, pregnancy. One is forced to use these methods either to prevent pregnancy or to delay or space pregnancy due to personal reasons. No doubt, the widespread use of these methods have a significant role in checking uncontrolled growth of population. However, there are possible ill effects like nausea, abdominal pain, breakthrough through bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. The medical termination of pregnancy Amendment Act 2017 was enacted by the Government of India with the intention of reducing the incidence of illegal abortion and subsequent material mortality and morbidity. According to this act, pregnancy may be terminated on certain considered groups grounds within the first 12 weeks of pregnancy on the opinion of one registered medical practitioner. If the pregnancy has lasted more than 12 weeks but fewer than 24 weeks, but two registered medical practitioners must be of the opinion formed in good faith now that the required ground exists. The grounds for such termination of pregnancies are the continuation of the continuation of pregnancy would involve a risk to the life of pregnant woman or the grave injury physical or mental health of their. Second, there is subsequent substantial risk that of the child were born it would suffer from such physical and mental abnormalities as to be seriously handicapped. Medical termination of pregnancy (MTP), intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy (MTP), and induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts one fifth of the total number of conceived pregnancies in a year. Whether to accept legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious, and social issues involved in it. Government of India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check discriminate and illegal female feticides, which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancies, either due to causal unprotected intercourse or failure of the contraceptive and during coitus or rapes. MTPs are also essential in certain cases. Their continuation of the pregnancy could be harmful or even fatal, either of the mother or the fetus or both. MTPs are considered relatively safe during the first trimester, that is up to 12 weeks of pregnancy. Second trimester abortions are must more resider, more more riskier. The one disturbing trend observed in is that majority of MTPs are performed illegally by qualified quacks which are not only unsafe but could be fatal to. Another dangerous trend is the misuse of amniocentesis to be female. It is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are the dangerous both for the young mother and the fetus. The effective counseling on the need to avoid unprotected coitus and the risk factors involved in illegal abortions, as well as providing more health and facilities, could reverse on the mentioned unhealthy trend. Sexually transmitted infections, STIs, infections or diseases which are transmitted through sexual intercourse are collectively called sexually transmitted infections, STI, or venereal diseases, VD, or reproductive tract infections, RTI, gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed of infection in the recent years, the HIV leading to AIDS are some of the common STIs. Among these, HIV infection is most dangerous and is discussed in detail in chapter 7. Some of these infections, like hepatitis B and HIV, can also be transmitted by sharing or injection needles, surgical instruments, etc. With infected persons, transfusion of blood or from an infected mother to the fetus to accept the hepatitis B, genital herpes, and HIV infections. Other diseases are completely curable. Now, if detected early and treated properly, early symptoms of most of these are minor and include itching. Females may often be asymptomatic and hence may remain undetected or for long absence or less significant symptoms in the early stages of infection, and the social stigma attached to the STIs deter the infected and lead to complications later, which include pelvic or inflammatory diseases, PID, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. STIs are the major threat to the healthy society. Therefore, prevention or early detection and cure of these diseases are therefore are given prime consideration under the reproductive health care programs. Through all persons are vulnerable to these infections. Now, their incidences are reported to be very high among persons in the age group of 15 to 24 years, the age group of to which you also have belong. There is no reason to panic because prevention is possible. One could be free of these infections by following the simple principles given below. First, avoid sex with unknown partners, multiple partners. Second, always try to use condoms during coitus. Third, in case of doubt, the one should go qualified doctor for detection and get complete treatment diagnosed with infection, infertility. A discussion on reproductive health is incomplete without a mention of infertility. The large number of couples all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sexual cohabitation. The reasons for this could be many play physical congenital diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but the healthcare units, infertility clinics, etc., could help in this diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples uh, could be assisted to have children through certain special techniques commonly known as assisted reproductive technologies ART. The in vitro fertilization IVF fertilization outside the body is in almost similar conditions as that in the body, followed by embryo transfer. ET is one of such methods. In this method, popularly known as test tube baby program, ova from the wife donor female and sperms from the husband donor male are collected and are induced to form a zygote under stimulated conditions in the laboratory. The zygote or early embryos with up to 8 blastomeres could then be transferred into the fallopian tube. The ZIFT, zygote intrafallopian tube, fallopian transfer, and the embryos with more than 8 blastomere into the uterus, IUT, intrauterine transfer. To complete its further development, embryos formed by in vivo fertilization, fusion of gametes within a female also could be used for such transfer to assist those females who cannot conceive. Transfer of an ovum collected from a donor into the fallopian tube, GIFT, gamete intrafallopian transfer of another female who cannot produce one but can provide suitable environment for fertilization. And further development is another methods at attempt intracytoplasmic system injection, ICSI, is another specialized procedure to form an embryo thus in the laboratory, in which the sperm is directly injected into the ovum. For infertility cases, either due to inability of the male partner to inseminate, the semen collected either from the husband or a healthy donor is artificially introduced either into the vagina or into the uterus, IUI, intrauterine insemination of the female. Through options are many. All these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. Therefore, these facilities are presently available only in very few centers in the country. Obviously, their benefits is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods, since the ultimate aim of these procedures to have children. In India, we have so many orphans, orphaned, and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption and it is as it one of the best methods for couples looking for a parenthood. Reproductive health, start करते summary. Summary. Reproductive health refers to a total well being in all aspects of reproduction, that is, physical, emotional, behavioral, and social. Our nation was the first nation in the world to initiate various action plans at national levels towards attaining a reproductively healthy society, counseling and creating awareness among people about reproductive organs, adolescence, and associated changes, safe and hygienic sexual practices, sexually transmitted infections, STIs, including AIDS, etc., is a primary step towards reproductive health. Providing medical facilities and care to the problems like menstrual irregularities, pregnancy related aspects, delivery, medical termination irregularities, pregnancy related aspect, delivery, medical termination of pregnancy, STI, birth control, infertility, postnatal child and maternal management of another important aspects of the reproductive and child health care programs, all and overall improvement improvement in reproductive health has taken place in our country, as indicated by reduced maternal and infant mortality rates, early detection and cure of STDs, assistance to infertile couples, etc., improved health facilities and ban and belief living conditions promoted an explosive growth of population, such a growth as necessitated explosive growth of population such as necessitates intense propagation of contraceptive methods. Various contraceptive options are available now, such as natural, traditional, barrier, mm, IUDs, pills, injectables, implants, and surgical methods through contraceptives are not the regular requirements for reproductive health. Now, one is forced to use them to avoid pregnancy or to delay or space pregnancy. Medical termination of pregnancy is legalized in our country. MTP is generally performed to get rid of unwanted pregnancy due to rapes, casual relationship, etc., as also in cases when the constant continuation of pregnancy could be harmful or even fatal to either the mother or the fetus or both. The infections or disease transmitted through sexual intercourse are called sexually transmitted diseases, STDs, pelvic inflammatory diseases, PIDs, stillbirth, infertility are some of the complications of them. Early detection facilitated by better cure of these diseases, avoiding sexual intercourse with the unknown multiple partner, use of condoms during coitus are some of the simple precautions. Avoid contracting STIs, inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility. Various methods are now available to help such couples. In vitro fertilization followed by transfer of embryo into the female genital tract is one such method and is commonly known as the test tube baby program. ह्यूमन रिप्रोडक्शन में हमने पहले से देखा. रिप्रोडक्टिव हेल्थ में हमने पहले से देखा रिप्रोडक्टिव हेल्थ प्रॉब्लम्स एंड स्ट्रैटेजीज, देन पॉपुलेशन स्टेबलाइजेशन एंड बर्थ कंट्रोल, medical termination of pregnancy, MTP, sexual transmitted infections, STIs, and summary. Thank you so much for watching. Please like, share and subscribe. Thank you so much for watching.